right, good evening and welcome to the season 4 premiere of the Green Table Talk. Tonight's episode is entitled Get the Lead Out, What to Expect from the EPA's Lead and Copper Rule. While the Biden-Harris administration has achieved monumental investments in lead service line replacement with the Get the Lead Out partnership, as well as historical legislative wins with the Bipartisan Infrastructure Law and the Inflation Reduction Act, the next pivotal need is for the Environmental Protection Agency to develop the most effective updates to the lead and copper rule. If you don't know what the lead and copper rule is, then you have come to the right place. Tonight we are joined by a panel of experts as we discuss what communities need most from the revised lead and copper rule. So before we get started, I want to give everybody an opportunity to introduce themselves, starting right here with Jamison.
Good evening, everybody. My name is Jamison Ford. I use all pronouns, and I'm 16 years old. I attend McKinley Technology High School, where I have the pleasure of being student body president. I was born in Memphis, Tennessee, but I was raised here in Washington, D.C. In addition to being a 3-sport athlete and various other extracurricular activities, I have also been a community organizer for several years. I've had the opportunity to work with the Black Swan Academy, Grantmakers for Girls, the Black Girl Freedom Fund, and of course, Black Millennials for Flint, for advocating for the liberation of marginalized communities across the country by all means at my disposal. And I'm very happy to be here, especially with you all.
Julian?
Hi, everybody. I'm Julian Gonzalez. I work for Earthjustice here in Washington, D.C. as Senior Legislative Counsel on our Healthy Communities team, where I work on lots of different water policy issues. My pronouns are he, him, his, and originally I'm from New York City.
Hello, everyone. My name is Sean Lamb. I am the Epidemiologist at Department of Energy and Environment, serving with the Lead, Safe, and Healthy Housing Division. I have been doing epidemiology for a few years now. I've worked on some notable cases before lead poisoning, notable ones HIV and TB, and as well as COVID-19. So I bring a wealth of knowledge in epidemiology to this panel. Thank you.
All right, thank you. And then many of you do know, but for those who don't, my name is Kayla Shannon. I am your host. I'm a senior at the illustrious Spelman College, an advocate for the city of Flint, and I do nonprofit work locally there in the city of Flint and Genesee County as a whole. So I'm really excited to get in this discussion. Beginning with Julian, in a brief summary, what is the lead and copper rule and how does it work?
Well, that's the big question, and I'll try to be brief. The rule is really complicated. I'm going to refer to it as the LCR for short, and the LCR is a really, really complicated set of regulations dating back to 1991 that are promulgated under the Safe Drinking Water Act, and they're basically the rules on what EPA and water utilities have to do to monitor lead in drinking water and what kind of action they have to take if they find lead in drinking water. Before I get into the details of that, I just want to go on a really quick detour and make a note. So there's a lot of resources out there on this topic. A lot of them, especially sometimes from water utilities and sometimes even from EPA, can be pretty misleading sometimes unintentionally, sometimes intentionally, to be frank. If you're looking for a place to start, one place I would recommend is a really great fact sheet that Earthjustice made in collaboration with a group based here in DC called Campaign for Lead-Free Water, led by Dr. Yana Lambrinidou and Paul Schwartz, two activists who are working on lead in drinking water here in DC for a number of years. So that fact sheet and their website, the Campaign for Lead-Free Water, has lots of easy to digest information on like the science, on myths about lead in drinking water, on what to do if you're worried about lead in drinking water. So check that out. That's a good starting place. All right, back to the LCR real quick. So it was initially put forward in 1991, a long time ago. It was not updated for over 30 years. As you can guess, it was due for an upgrade. Through the Obama administration and Trump administration, EPA worked on that update, and they finished at the end of the Trump administration. And you would think that an update for the first time in 30 years was a big deal, And it was a big deal, but unfortunately the revisions didn't really address the main shortcomings associated with the original rule. And in some cases, it was actually a step backwards. For example, the rate of replacement of lead service lines that it required was actually slower than the 1991 rule, which is one of the reasons why Earthjustice sued EPA about the rule. So what we're hoping for is a new rule that is stronger from EPA in the coming months. So how does the old lead and copper rule work? Well, it focuses on detecting and preventing contamination that is severe across a whole community, which sounds sensible, but you got to remember, and you'll probably hear more about this from Sean, any level of lead isn't safe. So the rule doesn't really help you if you're an individual family that's trying to be protected or is worried about lead contamination in your house. So this is the analogy I like to use, that this is like having a fire department that only springs into action once half the neighborhood is already on fire. That is a useless invention, and it's a problem. So hopefully the new rule will be more impactful and protective. So that's why we say at Earthjustice and in some of our community groups that we partner with, that the lead and copper rule is not really a health-based regulation. A water system or a city can tell you, we're in compliance with this, and it actually doesn't have anything to do with whether you're safe or not. The relationship between compliance and protection from a public health perspective is not existent. So this rule is really has just been historically ineffective, which is why it's a really big opportunity for EPA and the Biden administration to have a new rule with input from lots of communities and lots of scientists and lots of people who've been dealing with this for decades, that actually is health protective and works with our communities and for our communities, rather than, trying to wave away public health risks.
Yeah. I like what you said with the analogy about a fire department, right? Because so often these legislative policies work to address or claim to address systemic issues, but aren't getting to the root causes of the issues and the impact that they have in community. So you've already spoken a bit to this, but what are some of the critical aspects of the LCR or the lead and copper rule that need to be revised? What are the recommendations that you would have?
Sure. So like I mentioned before, the rule is really long and complicated, so I could spend like an hour on that question, but I'll focus on 5 quick things, which if you're tuning in for this, you may have heard about. So the first one is a requirement for utilities to proactively replace all lead service lines within 10 years at no cost to the folks who have contaminated water. So that's something that a lot of communities have been fighting for. Lead comes from a lot of different sources. You can get lead from dirt, from soil, from air, from fuel, from lots of different places, from the fixtures, not just the pipes, but sinks and other fixtures in your house. So taking lead service lines out isn't a silver bullet, but taking lead service lines out is a really, really strong first step towards reducing lead exposure in our country. So that would be a major win if the rule could do that. Another thing is banning partial replacements of lead service lines. So what happens in a lot of communities, like here in DC, what had happened once during the aftermath of our lead crisis is part of the line goes under the sidewalk in the street, part of the line goes under your house and into your faucets and things like that. And a lot of cities will say, well, we're only allowed to replace the public part under the sidewalk, and they'll do that, and they'll say, if you want to replace the part under your house, you have to pay for it, which costs lots of money, thousands of dollars. And if that's the policy, then who's going to get their lead service lines replaced? Wealthy folks in the wealthy parts of cities and communities, and low-income folks will be left with not just with lead exposure, but with probably more lead exposure than they had before, because taking out half the line disturbs the lead and can cause contamination to rise compared to if you just left it alone. So replacements are one thing. The third thing I'll say is an action level. So the action level is basically the point at which EPA and water utilities begin to have to do stuff. If they detect a certain amount of lead, then requirements follow. And In a lot of other countries, in Canada, in Europe, the action level is 5 parts per billion. That's the measurement. For the lead and copper rule, the old lead and copper rule, it was 15. And again, remember, even 1 part per billion is dangerous, puts you at risk. So 5 is really like, you're not even promising safety, but you're coming much closer than if it's 15. The fourth thing is requiring point of use filters for those with lead service lines or lead action level exceedances. In some cities, like Denver, Colorado, the water systems are actually providing those to folks who they know have lead service lines, just to help with, exposures as these lines get replaced. And when you think about how many sources of lead exposure there are, I always tell people you should just err on the side of having a filter if you can, even if you think you have no lead service lines. But if you have lead service lines, and if you're going into a community and doing construction and replacing them, you don't want people to deal with increased lead exposure while there's all this construction and removal of the lines. So filters would really help. And then the last thing I'll say is require more thorough water sampling and monitoring. And this is something Sean knows a lot more about, but data collection on lead in drinking water is a big obstacle in a lot of communities and cities. We don't even know where all the lead service lines are. There's different ways you can monitor for lead in drinking water correctly and incorrectly. We need scientists to do this. Like, policymakers are cool, but we need to follow science, modern, updated science on what's the best way to monitor if we want to tackle this problem. So the new rule should require those 5 things at least, and a whole lot more if you want to get into it.
Thank you. And I resonate with a lot of what you said in considering my experience with the Flint water crisis, right? Where there were people that were advocating and talking about the issues that were happening in the community for years before there was any type of government intervention, and they were told that they were crazy. And there was the whole publicity stunt with Obama coming in and drinking a glass of water that very clearly did not come from the same pipes that these citizens were complaining about. And so I think it's very important to bring attention to the fact, though, that we should all be erring on the side of caution at this point, right? Because so often people feel a sense of comfort in their communities because it hasn't yet been brought to their doorstep, right? But it's important to recognize that there are so many different sources of lead exposure, and that the regulations are so low and the standard is so low, even federally, that it's very difficult to ensure that your community is not being impacted. So to the community members out there that are watching, please be sure that you are staying educated and up to date in your community about what the possibilities are. Test your water. Even if you don't think that there's a possibility, even if it's not in the news, test your water. Even if there's no smell, if there's no color, it's important to just be aware of what's going on in your household. Especially according to the statistics. So according to the Get the Lead Out report from Environment America, over 50% of states are rated a grade of F based on the assessment of laws and regulations pertaining to lead contamination of schools' drinking water. Washington, D.C. received the highest rating with a B+, which means that there's still room for improvement. While there is not a federal mandate for testing for lead in schools and child care facilities, Julian, can you explain what is required for schools and child care facilities that have their own water supply?
Sure. So as you alluded to, it really depends on what state you're in, but from a federal level and looking at the lead and copper rule, the one from 1991 that got updated during the Trump administration, elementary schools have to test their water. They have the lead sample once every 5 years. And after that, only if the school or facility requests testing. The results of that testing has to be reported to the state, but not to parents, not to students, not to teachers. And there's no requirements to reduce lead levels after that. So the rule doesn't really do much in the way of protecting children in schools from lead in drinking water. It's a lot of testing and then kind of chasing instead of a more effective approach, which a lot of people call filter first, which is like, this is a school. It's a place where kids spend a lot of their time. These kids are at risk just because they're younger, and lead exposure to children can be really harmful. So don't worry about all the testing and instead just have filters on your water fountains and your faucets, and make sure test the filters, make sure they keep working periodically, but just err on the side of caution, and just filter first. And that's a lot of states, you'll find activists pushing for new state policies and legislation where that's the goal, is to just have a policy of filter first, err on the side of caution.
Sean, as an epidemiologist, from a public health perspective, what are the health risks, particularly for children, if the LCR is not revised in the most effective way?
Yeah. Thank you for that question. Off the bat, we talk about neurological damage, right? We're talking about slow growth and development. This leads to a lower IQ, difficulty speaking and hearing in children, and can lead to different systematic health issues. But most importantly, not most importantly, but a little caveat to that, right, is the chronic lead exposure, right? So when we talk about like chronic lead exposure, we're talking about kidney damage, anemia, and toxicity to reproductive organs, right? And when I'm kind of shaking while saying this because it really is kind of scary, but as you go forward, what happens is if you have a child that grows older for adults, again, as they grow older, they start seeing that they have these problems that, it costs. These are health costs. So now you're dealing with a population, an underserved population, right, who now has health problems because of this, because of lead exposure at a young age. And then now you have to pay a hospital bill just to, catch up. So, I mean, if we don't continuously change the LCR, then these problems in these underserved communities, these problems in the world are going to continue to happen.
Of course.
Yeah.
And to your point, like a lot of these impacts are not like from the Flint water crisis. I've been in discussions where we've talked about the fact that we won't even fully understand the impact of the crisis on our youth until decades down the road, right?
Correct.
Until these are the youth that are actually working in, that are active participants of the workforce.
Correct.
And when we talk about that being compounded by the health insurance issues that we have across our nation, especially in marginalized and underserved communities, it's going to be that much more difficult for many of these people who were greatly impacted by the Flint water crisis and who were only cut a marginal check by the settlement that was received from the state of Michigan to receive the necessary support that they need, right?
Correct.
And that, of course, compounded by the other systemic issues and health injustices, the food deserts, and everything else that continues to support health disparities in our nation. So thank you so much for speaking to that.
And just to add to your point, just
Please.
a little bit more, there's always literature coming out every day. When I say literature, speaking of reports and different studies that have happened, GW just released, I think it was
what is GW for the people?
Sorry, George Washington University. They had just released, a scientist, a very smart scientist, just released the association between criminal behavior, like later on, and associated with lead poisoning at a younger age. And people are now looking at that and picking that apart. So it spans so much what happens at a young age.
Yeah.
To your point, as you grow older, what can happen to that person, to that individual. So,
Thank you so much for that point, Sean. Many of the conversations surrounding the LCR are not prioritizing youth voice, who, as we've spoken to, are greatly impacted, disproportionately even so, by these rules. Jamison, as a youth leader and a current high school student, what is your perspective on what the Environmental Protection Agency should prioritize in the revision of the lead and copper rule?
From a perspective of the youth, I think it is important to raise the question. We see these laws, these legislations and actions being passed, but then what is the action being taken after that, right? Something that I think about often is how these young people, again, like you said, will turn in to grow into actual people, members of society, people that are working, everyday people, and they will have to face the consequences of things that they don't even know about.
Yeah.
And I think it's important to hold water systems accountable, to hold factories accountable, to hold people in power accountable to these revisions, but ultimately they are here to protect the people, especially the people that this country has failed to protect. Therefore, we must prioritize the people, especially the youth. So the EPA has to prioritize connecting policies and initiatives to the very communities that they intend to serve in order for them to be effective. Some of the things I even thought about were ensuring that the revisions are available and recognized by all schools and parents. Just a school being able to recognize that there are things that can be done and taken in place to protect the kids at their school, protect the parents, protect the families that they serve is so powerful and can impact an entire district, let alone an entire city, an entire state. Social media campaigns, not only just social media campaigns, but things that are interactive, things that are visual, things that young people will want to see, want to understand, and that they can digest. I'm telling you now, we're not reading government documents, y'all.
Not.
We're not.
Not.
We're not. Things have to be digestible and understandable. Creating partnerships with the community. If you intend to serve a community, use the people from that very community and allow feedback. If you want to be a true entity of the United States government, then you must allow feedback from the people in order to be better, in order to expand, in order to do what you intend to do for the community. So.
Thank you. That's great, especially when you talk about accessibility. That is a major gap across all municipalities, ensuring that not only are they enacting policies, but it's clear to the communities that they're serving what these policies are, what purpose they're meant to serve, and then following up for feedback as, is it serving the purpose that we thought, right? And not following up, another decade down the road. Like you said, they're only even required to test every 5 years. But how often are we really following up to ensure that these policies are having the impact? And then going a step further to systems of accountability.
Right.
Something that stuck out to me is there's a quote from, and I'm struggling to remember the name, but there's a quote that says, "How are the youth?" Right? And the measure of how well the youth in a country are doing is an indicator of how well a country is doing, right? And so we have to be clear, not only that we're checking in on how the youth are, but that we're intentionally seeking the perspectives and implementing the opinions of the young people who will ultimately inherit, right, the nation, the earth, the world, right, from older generations.
Of course.
So moving right along, lead levels as low as 1 ppb can cause cognitive and developmental issues, particularly for children and childbirthing people. And you spoke to this a little bit. The current lead and copper rule designates 15 ppb as the actionable level. That's what you were speaking about, Julian. Sean, why is it critical that the revised LCR significantly lower that action level?
So, besides the main fact that lowering the action level, and I just wanted to say, disclaimer, this is not based off of DC government, but based off of Sean, the epidemiologist. Okay?
Yes.
But yes, the main fact, besides it would lower health outcomes, in specific populations, is the hypersensitivity to childbearing people and children, right? So, as Julian said, you're talking about the most purest form of individuals, right?
Yeah.
You're talking about a baby, and no matter what level it is, it's gonna affect the child. So moving forward, that should already let us know that, hey, we need to check this out, right? And when you're saying, hey, we need to look at the LCR and see if we need to make any adjustments, right? That's when that's when the community and the public, when we're speaking about public health, we want public trust. We want them to know, hey, look, we're looking at this not because we see that there's a problem, we're looking at this because we see that we can help, and we're continuously trying to help. So that's another reason. But also, making mention to DOEE, our action level, we do it at 5. So, as EPA does it, we jump into action at 5, and when we jump in, we put that filter on, and we do amazing work there. Let me put it to the CDC reference value, right? So our CDC reference value is it got lowered to 3.5, right? So when I'm looking at cases, right, we're talking about surveillance epidemiology. When we're looking at cases and we're saying, hey, when it was at 5 points per billion, we said every single child in Washington, D.C., when they have a blood lead level of 5 and above, we're going to jump into action, and this is a case, right? When CDC dropped it to 3.5, what we started to see was, okay, there was a lot of 5s in this area. There was a few 5s in this area, and we thought these two were the hot spots. No. Then we saw about 50 3.5s where there was 1 5. And we started realizing, oh, wait, this is the hot spot because there's more patients that are being affected by lead exposure. And going back to Julian's, and I'm so happy you said this, right? The fact that no matter what the level is, it will affect a child leads us to say, hey, maybe dropping it will push us forward to looking at those underserved populations just a little bit more, right?
Yeah.
So that's why it's important.
Thank you.
Yeah.
And that just sticks out to me so much because of, as you said, when the levels are lower, the attention is heightened, right? We have a greater database or data set to look at, right, and to consider. And so often, once again, the government truly is just not interested to take action, right? Like sometimes. The government is not interested to take action or maybe does not have the necessary resources or understanding to take the action to adequately address the issues that are impacting the communities. So you make a great point. Julian, going back to you, why do you think the EPA has been resistant historically to lower lead exposure actionable levels? In your opinion, what strategies could help push the EPA to lower that action level?
Those are really good questions, and they have very different answers. So why EPA is historically resistant to this sort of stuff is a question where the answer is not really unique to EPA, and it's not really unique to this issue of lead in drinking water. You're talking about why does a federal agency not respond to the communities impacted more, to communities of color, compared to how they respond to other interests that have money, like water systems, or have an interest in not raising public panic by making it really hard to learn, for example, if there's lead in your drinking water, which most water utilities do. It's a whole nother Zoom webinar about how to figure that out, and it's not easy, but if you want to find out, there's a lot of resources around there, and if you can't find them, come find me and we can work it out. But
come find me.
Yeah, exactly. And lead in drinking water is no different. The folks who are impacted the most have the least political sway, have the least political power, and without changing that dynamic, EPA doesn't change. So right now, what we need to do is take advantage of like really broad coalitions, working with youth activists and folks who are impacted in different communities, working with schools and people who work in childcare, to really show that like this is a priority. You can't just talk the talk for this administration. You have to walk the walk. A new rule has to be significantly better. I spent the whole first 15 minutes talking about the ways that rule failed people for decades. And we need to leave that way in the rearview mirror. It can't be tweaks to that old rule. That has to be this has to not resemble the old rule at all if we want to really be health protective. So how do we go about that as an advocacy community? Really, it's just making noise, and a lot of it is public education. This issue is really complicated. I'm a nerd. It's really hard for me to not get super nerdy right now when talking about this because the lead and copper rule is hundreds of pages long. So the more we can teach people and they can teach other people about how to learn what's in your drinking water and what these things mean when you get these documents from your water utility, the more we can work to hold those folks in power, whether it's water utility, whether it's people in Congress, to hold them accountable to get this new rule. This rule is going to come out sometime this fall, and then EPA will be taking feedback from people. And there'll be lots of different ways where folks from all walks of life can provide feedback to EPA directly, where folks can write to their newspapers, can blog, you can tweet about it. All of this stuff matters. All of this stuff adds up. And we have to make as much noise as possible together about this.
Thank you. So even though children are the most vulnerable to lead poisoning and exposure, students do not learn about lead poisoning prevention at school. Jamison, how could public schools play a larger role in educating youth about lead poisoning prevention, and why is it so important that they do?
Honestly, for public schools, it can be as simple of just understanding what science literacy is, right? That's a term that's even new to me, and I'm 16 years old. But it is never too late to introduce somebody to something, because I'm learning this at 16 years old, but there are people who are much older than me that have never been introduced to the word or its importance, its significance at all. As I mentioned, I attend McKinley Technology High School, where I am a part of the biotechnology program. Shout out to Ms. Barker, Ms. Richardson, and Dr. Schuster. And there, they are extremely dedicated to teaching us about the ethics of community research and how that impacts vulnerable communities. We actually, on the first day of school, did an assignment where we were to vote on actual legislation that impacted certain communities with little to no information about what they did other than their name and a small description. But that is what most people that vote have to work with. They have the name, the description, a little bit more than that, and where it came from. And we voted, and y'all, we almost blew the world up. We almost did. But understanding that even the small decisions that you can make as a voter, as an individual person, and not understanding its impact scientifically or even just its impact on a community level is staggering, right? I think it's important because children are so receptive to knowledge and will conform to practices that will protect them. Reaching out to other environmental justice community organizers, such as myself, there are plenty in this city, across the country. Bring them in. Youth expand off of each other. Use each other and help them use each other to cultivate a conversation around science literacy and incorporating lessons like I said my teacher did into science classes, history classes, and not just staying there, knowing that science literacy goes broader than that, right? It goes to reading English classes, it goes to history class, science class, math class, and beyond.
Thank you. And what really stuck out to me is you talking about the fact that youth will conform to the environments that we create for them, right? And so much, and I could do an entire podcast just about the issues with the education system, but one of the large ones that sticks out is so often our education system does not take the time to apply the information to how it can be used in our everyday life, right? So when you say talking in science classes about lead contamination levels and testing water, these are science experiments that can actually work to save lives, right? Talking in social studies classes, not just about history, but also about advocacy, right? Also about getting involved in the community, about how easy it is to be involved in community and in community, and how impactful it is to send a letter to a legislator, right? To send an email, to show up to city hall meetings, to be active with the city council, right? Like how important it is it's very important that youth not only understand the ways they can get involved, but also that they are incorporated into the system before they're 18, right? Because so often young people are under the illusion and the impression, because of our system, that the only way to be involved is to vote when you turn 18.
Right.
And until you're 18, there's nothing that you can do. Nobody's really interested to hear from you, or that your voice doesn't matter in these discussions, right? And so through integrating these social issues that are actively impacting our youth and will continue to impact them down the road into school environments, we create a generation, or we can create a generation of youth who are more adequately equipped to participate in civic engagement before they're 18, right? As young as 16, or even I was participating in social justice advocacy work in middle school, right? Because I had a community of people that made it seem accessible to me.
Yes. And of course, like, we are aware of the things. If I ask my classmates, my peers, my friends, they are aware of the Flint water crisis, of course. But even just something as simple as that is already a step. Imagine if that knowledge was cultivated into something more, if they understood the significance of that knowledge, if they understood what they can do, if they shared that, if they did more research, if they understood how they could become connected to the community and to the liberation of that community and getting them access to clean, drinkable water.
Absolutely, thank you. I'll come to you before we end, all right? So moving forward, Sean, how can environmental justice organizations best utilize healthcare professionals and public health experts to advocate for a stricter lead and copper rule?
So, data. If the community, and again, this is disclaimer, this is Sean Lamb, the epidemiologist, talking. If we're talking about a community organization, and I'm a part of a community organization, right? I am going to create surveys with my community organization to understand who and what's going on with my physicians and my healthcare practitioners who are testing my patients. Testing my community, right? I want to know what the data is for myself. And then I want to go to a government official, say an epidemiologist. I would go to Department of Energy and Environment, and I would say, hey, I found this data. I created this, and this is what I found. How does this match up with you? And then from there, I'm like, because the thing is about the government that a lot of people don't understand is these are also people. Like, they have families, they have kids. They don't want their kids to grow up with lead poisoning either, or anything of that nature. And they're working super hard, but the resources are not the best at times. Mm-hmm. Again, Sean, the person, is talking. Okay?
Yes, Sean the person.
Sean the person. We got resources for dating. So with that, right, I'm taking that information and I'm going towards the government, right? And I'm saying, hey, I found this information, and then can you guys give me your information, and let's make something big. And then once we have all of that, right, we'll take that and create a policy. Mm-hmm. And we'll create a proposal and say, hey, my government entity, can we lobby for this? Mm-hmm. Can we do this because I feel like it will help my community? So it centers around data and it centers around evidence. I think at times when I'm in these meetings, I realize that the community organization, they're very, very smart, but they lack the evidence. Mm-hmm. And it's not their fault because at times it's like, hey, this is the evidence that we found.
Yeah. Right.
But it's like we need it on the first-hand account. Sometimes we're not getting the evidence from actual real world data. It's just sometimes it seems a little made up, or when we go back we're like, hey, we have it for ourselves, and that's not how we did it, and it doesn't match up. So if the community organization works on the data piece with our government entities, I feel as though that would help a lot more in getting some of these policies changed.
Thanks, Sean. So Julian, back to you. From a legal perspective, how can parents and advocates best hold water utility providers accountable for reducing lead hazards and exposure in drinking water?
So that's a tough question because the laws for folks from all walks of life to just use the courts as a vehicle to hold water utilities accountable, they're not really built for that. The Safe Drinking Water Act is the main law that regulates drinking water quality, and it is kind of impossible to use for lawsuits. I say that as an environmental lawyer who works with a bunch of others. It's not the best law. So legally, it's pretty tricky. What I will say, piggybacking off of what Sean said, is from an advocacy perspective, there are other ways to hold water utilities accountable that relate to education and experience and expertise. So there's different kinds of expertise that everyone's have. Sean talks about scientific data, epidemiological data, which is really important to help make an argument about the effects a community might be facing from lead contamination. Where lead service lines are is another form of data that it can be really difficult to find. But another type of expertise is lived experience. Like, do not let anyone ever tell you that you're not an expert if you're an advocate. You are an expert, and water utilities might sometimes try to say otherwise and say, well, like, you're just an advocate, you're an activist, you go to protest, you go to high school or whatever. We need this, we need that, we have scientists, we got degrees that cost a lot of money. Don't listen to any of that. You all, if you're an advocate, you're an expert, and you need scientific data, but it's also valid to let people know, hey, my community has dealt with lead exposure for decades. That matters. Our experiences matter. That history, that harm is part of the historical record and should be a factor when you're deciding how to deal with this, when you, Congress, are deciding how to make your policy. And we need to acknowledge that, and everybody needs to rally around that, because as long as water utilities and other folks in positions of authority pretend to have the only source of expertise, they will use that as a way to say, we have to make the decisions and we know better than you. Don't worry about what exactly is in your drinking water. We're in compliance with all the laws. When compliance with the lead and copper rule doesn't mean anything regards to whether you're safe. So really, knowledge is power, and whether it's working with scientists or working to just learn what's in your drinking water and get a bunch of people in your community, other advocacy organizations to do that, they're counting on you, us, we not having that information. That's what they're relying on. Because as long as we don't know what's in our drinking water, they can say, oh, we're following the law. Even if they say we're following the law, if we say, hey, it says 15 parts per billion, that's compliance, you're in compliance, but there's 5 parts per billion in my neighborhood. And maybe I don't have the luxury of living in DC where the action level is 5 parts per billion. Maybe I live in a community where the water utility is doing nothing because they don't care as much as DC might. You need to make them care. You need to show newspapers, show media that, hey, even though they're following the law, we're in big trouble right now. There's a lot of communities like Benton Harbor, Michigan, where they had a lead crisis and the water systems there were in compliance with the lead and copper rule.
Yep.
Just let that sink in. That is insane. And the only reason they were able to get action was because folks in the community got together and told a lot of people outside the community what was happening. And they had the data to back it up. They had their experiences to back it up. So the more we can do that, the more we can hold water utilities accountable.
Thank you. Jamison, what are some ways that youth can become more knowledgeable about lead poisoning prevention and spread awareness to their peers?
I really appreciated what Julian said, because the first step for young people especially to become aware about the things that are going on in their communities, especially with environmental justice, you never let anyone illegitimize the struggle that you feel that you are facing, that the people in your community are facing. You continue to fight for what you believe that your community should have, the right to have, and you don't let anybody stop you from doing that. Every time I ask my mom a question, she always tells me that I have a phone. So I encourage you to use your phone, use your computer, use your library, use the adults around you. Use what you have to get the questions, to get the answers to the questions that you have, right? And even if they don't have the answers to the questions that you have, I bet you Google has somebody that you can go ask a question to and get the answer.
TikTok might have it too.
Exactly. Go on TikTok, go on Twitter, go on Instagram. If you type in lead and copper rule, if you type in lead and copper rule revisions, if you type in Environmental Protection Agency, something will come up, and I bet you that you will learn something that you didn't know before you clicked it. Just using your social media platforms, using what you have at your disposal right now will make an impact, right? I know sometimes it's hard to reach into like your daily news, but even small things like following an Instagram page that reports daily news and occurrences in your community is helpful. Not only do you retain information, but you can supply them with information, and so the whole entire community is aware, right? Speak to your teachers, speak to your adults, hold the people around you accountable for their resources. Your city lawmakers, your city council members, your city government, your state government, your federal government, they are accountable for ensuring that you are safe and that your rights are being met. If they are not doing so, hold them accountable. Use that. Use the people around you. And use your creativity, right? Not everything is the same. Advocacy is not linear. There are plenty of ways to be an advocate for what you believe is right, whether that is art, whether that's writing, whether it's music, whether it's speaking on panels, whether it's making speeches, whether it's calling lawmakers, whether it's teaching other young people. Whatever you're doing is making a difference, and whatever you're doing means that you are an advocate. And it's just as meaningful as anything else.
Thank you. I actually studied in part for my senior thesis about the use of social media as a fact-finding resource. And as generations go on and technology evolves and becomes more prominent across communities, especially in the U.S., it is becoming a more primary fact-finding resource. So I definitely do highly recommend utilizing that as a resource for spreading information as well as accessing information. Now, I will add to that, it's extremely important to fact check what you find on social media, right? Because people recognize the power of social media and thus use it, have used it to also spread dis and misinformation in communities, right? So you want to be sure that the sources that you are accessing are actual credible, reputable sources. And also, if you find something on social media, before you share it, it might be a good idea to just hop on Google real quick, right? Fact check the resource that they claim to be citing, right? Make sure that the statistics or data sources that they're claiming to draw from are accurate, because the last thing you want is to have great intentions, right? And want to share good information in community and accidentally, without knowing it, support the misinformation that's being spread online. So absolutely, I'm an advocate for using social media, Instagram, Twitter, Facebook, TikTok, whatever platforms that you have to spread credible information, but be sure that you are accessing credible information. And also, I would add to that, sometimes in the spread of social media, we only connect with or read portions of important issues, right? So it may be also a good idea, even though you find the information on social media, to still look for reputable sources where you can read more about the nuances, the facts, and the details of a certain case or situation, so that you, as a citizen and also as an advocate for your community and for your peers, are able to have as much of the details and information possible.
Can I add on to that? I also implore young people, especially because it's important to facilitate this practice while you're young, go outside of what many people like to call your echo chamber. Sometimes when we agree with things or we have certain things that we like to look at on the internet or in our personal lives, that is the only thing that we see, and that's the only thing that we receive back, the things that we believe. You have to understand that in order to do true research, in order to understand issues, that you have to go outside of your echo chamber. Not saying that you're going to change your mind or that your opinion on something will be deterred or like something might change for you, but just to understand what you believe to a better extent will make a difference if you go outside of your echo chamber.
Yes. And today you have to actively seek that on social media,
Every
because
day.
social media will cater to what you've liked, what you've interacted with already, what you've shown it based on your browser searches that you believe in. So it's something that it's important that you're intentional about doing. We're coming close to the close of our show, but as we end, we always like to leave folks feeling empowered. So if each of you can just give a couple brief words about what one recommendation you think those watching tonight could make to the EPA.
What I said. Please start documenting different things and lean more towards data.
I'll say, so EPA is going to begin taking feedback at some point in the next couple weeks, couple months on this issue formally. And there's a really easy way you can provide feedback, and you just Google Earthjustice, lead and copper rule, and will come a webpage that has an easy to fill out form where you can write whatever you want to tell EPA, stuff that you learned today, stuff that you learned when you go to Google, when you go to campaignforleadfreewater.org to learn more about the science and the advocacy here in DC. And you can just tell them. You can just tell them through that, and the more feedback they get, that'll be very helpful for them.
Jamison?
I agree with what Julian said, right? They're going to take feedback eventually. And we all know the communities that we live in. We know our people. We know who we are. We know what we need. So question the people in charge. Question the people that are supposed to keep you safe. And with that, seek liberation.
Thank you. Again, thank you all so much for joining us for another episode of the Green Table Talk. We host hybrid episodes on a monthly basis. Please join us again right back here, same time, same place next month.
Bye.